The Northern Community Public Health Center, where our Tomas Manglotny is standing by for this public health press conference. Tomas, good morning.
Hi, Chris and Bree. We're here at the Northern Region Community Health Center for the rollout of the pediatric COVID-19 vaccine. Some of the first kids on Guam getting this pediatric vaccine. And now joining us is Janela Carrera. Janela, good morning. How are things going here with this rollout?
Doing great, very well. We see a lot of our children in line. We're very excited to see the turnout this morning. So now we're actually processing the first of our patients, our pediatric patients, as we speak. So we just opened up the line. Our nurses have already drawn the first vials for the pediatric COVID-19 vaccine. So we're pretty excited and we're ready to go.
And so Guam received about 7,500 doses in its first initial batch. What is registration looking like now, to the best of your knowledge?
So right now, as far as registration, I'm looking, I haven't seen the back end in terms of our online registration, but just as seeing the first 9 o'clock, the first slot time frame, just eyeballing it, it looks to me like about 40, 50 people, or patients rather. 40 to 50 patients, pediatric patients. And we're hoping that this continues because based on the number of appointment slots that we make available per hour, it's about 40 to 60. So it looks like it filled up for this time slot, and we're hoping it continues that way. So it looks pretty good.
All right, and so what's the testing vaccine strategy moving forward, given that this is now available on the island?
Yeah, so I think right now what we want to really focus on is just making sure that we address any concerns from our parents, from the pediatric population, students, parents, guardians, the school education system. So what we want to do now going forward is have a series of town hall meetings, meet with our stakeholders, make sure that any of those concerns are being addressed. We want to ensure that the communication strategy is robust, that we ensure that whatever messaging is out there reaches as many parents as possible. And we really, ultimately it's to protect our youth, our children, because we do know what types of effects COVID-19 can also have in our youth. We've seen it. At one point, we saw that the hospital had pediatric COVID-19 cases. And so this is another measure for us, another layer in our mitigation efforts to protect our children.
As for vaccinations during the weekend, any plans on that?
Yes, actually, I'm glad you asked. That is still on track. We are still working with GDOE, as well as our other educational partners like private charter schools, Catholic schools as well, so that we can have our weekend school-based immunization. And we're also working with our pediatric private clinics as well, so that we can make the COVID-19 vaccine for children available. So weekend school-based immunization is still on track, and we're still working with our education stakeholders to make sure that occurs.
And you touched on that a little bit, but there might be some folks who still might be hesitant to have their children vaccinated. At this point, it is a choice. Do you have a message to?
Yeah, sure. No, absolutely. With any type of vaccine, there's always going to be, hesitation, concerns, issues. And we want to, of course, address those concerns. And so part of that is ensuring that we can get that message out and make sure that it's also fact-based. And so we partner with institutions like CDC, WHO, so that we have the right messaging out there, the right messaging strategy to the community. One thing that I do want our parents to be reminded of is that, a lot of the COVID-19 cases, sure, in the beginning were of the adult population, but, we did see COVID-19 cases in our youth, in our younger population as well. And a lot of the things that I'm hearing out in the community are, our children don't need this because they're strong, their immune systems are strong. And, that may be true as well. Our younger population, our students, and our children may have stronger immune systems than our adult population, right? However, we have also seen a rise in pediatric cases. COVID-19 cases.
And can you speak to any side effects and also the monitoring time here?
The monitoring time is about the same, 15 minutes to 30 minutes, depending on the medical history of the child. And so the dosage is also a little bit smaller, but as far as monitoring, it's about the same.
And what do parents need to bring if they're walking in here?
So they would need to bring the birth certificate for their children, and then of course a government issued ID. If they're a legal guardian, any legal guardianship paperwork or documentation to show that they are the legal guardian of the child.
And you said your kids?
My kids are here. I did bring them today, so I did schedule them for an appointment for the 9 o'clock hour. I, as a parent, I'm taking my hat off as the PIO and putting on my hat as a parent. I have been waiting for the vaccine for my children. They're 10 and 11. I brought both of them. So I'm actually really excited as a parent because, you know, they can finally, for me, it's a peace of mind. I can bring them, send them back to school without so much of a worry. I mean, there's always risk in anything you do, right? But I think this lowers the risk and it mitigates the risk. So it brings me a lot of comfort, a lot of peace of mind for my children too. They've actually expressed to me that they don't want to experience what they've seen or heard about in other cases of COVID-19.
I'm not sure if you're able to address what the vaccine will look like for schools or rolling out in schools. We know in the CNMI at least, right? They
Yes.
putting out a public notice for potential mandates. Or is there anything on the horizon?
I've not heard of any. That discussion hasn't been made so far. I don't know if that's something that will be made or is on the horizon for us in the future. But at this time, our focus right now is to get as many pediatric or as many children vaccinated with the pediatric vaccine. We just started and launched it today. So that is our primary focus. Any discussions about mandates, anything like that, really, I think is more of on a policy level. And so I think perhaps that's something that maybe you would direct towards the governor's office or something.
Yes. And any update on the CDC visit? We know that they've had some time here so far.
Yeah, so they've actually been pretty busy. So they're all here, all four of them. They all made it last week. And so for the last day, so yesterday, as well as last week, they've actually been working very closely with our team, with our territorial epidemiologist, Dr. Ann Podletsky. And so they've been providing the data and working very closely with them, looking at the data. We've also reached out to some of our healthcare partners, just so that they're aware that we do have our CDC team here, and that they may be wanting to work with them so that they can also take a look at their data as well, and any information that they can glean from that may be helpful to us.
And speaking of that data, we're seeing the CAR score drop. I believe if it goes to 5, there's always been a triggering of easing of restrictions. Is that on the way too, given the CAR score decreasing?
Well, I know that there has been some discussion, some talk within the community, the physicians advisory group. I know Dr. Bob had mentioned that if things look good, right, that there may be easing of restrictions. Of course, ultimately that decision rests with the governor, but we do have our advisory groups, our physicians, our medical community that would be able to advise the governor of what types of restrictions, and this would have to be based on data. And so far, what we're seeing with our numbers, with our trends, as you know, we had our data with Dr. Ann last week. We are on the downward trend, which is really great. And hopefully we can keep up with this and maintain it and see some restrictions lifted. But again, I just want to say that this is really based on our ability to maintain this, and of course with the governor, it's really up to her. But of course, based on evidence, data, and advice from her closest advisors
And
in the medical community.
any info on private clinics providing the pediatric vaccines?
Yeah, so we're actually working very closely with them, and we do have interest from them to provide the pediatric COVID-19 vaccines in clinic. So far, I don't have the exact number, but we do have a number of them already expressing interest. So once all of that is finalized, then we can make an official announcement as to which pediatric clinics will have the COVID-19 vaccine available for the pediatric doses.
Right. Is there anything else you want to share today?
Yeah, I'm just, we're very excited about today. And I just want to also mention that we have also, all the attention is here at our Northern Clinic, right? But we also have the Southern Region Community Health Center that's open right now, actually, as we speak. So for those who live in our southern villages and it's more convenient for them to go down there, that place is also open for our children as well to get their vaccine. And then later on today, the UOG Fieldhouse will also be open for pediatric vaccines as well. So I just want to make sure that the community is aware of the availability today.
All right, thank you. Of course, dozens of children right behind us. I can't exactly show every single one of them at the moment, but thank you so much for your time. Appreciate it.
Thank you very much.
All right, good luck. All right, Chris and Bree, we are, of course, here at the Northern Region Community Health Center. I can't exactly show you images of the crowd right now, given that there are minors, lots of kids in them, but hearing the latest there from PIO Janela Carrera.
All right, thanks a lot, Tomas. Great job. I guess the press conference didn't necessarily happen, but that's okay. We still got something from.
Yes, our Daniel Perez is inside, I believe, getting some of the first children to receive the shot with the consent of their parents. So our Daniel Perez will have that full report on primetime.
All right, thanks a lot.
Thank you, Tomas.
Tomas, thanks, Daniel. We did see him pop in